I've uncovered a shocking non-policy policy at Parks Canada with regard to medical assistance in dying, or MAID. My advice to you: beware when hiking in one of Canada's gorgeous national parks after March 2024.
This work will begin in the new year. Right now, we want all Canadians to know, especially those exempted by the current exemption of eligibility from MAID, that we plan to take this next step. This is a top priority for our government, and we want to reassure Canadians that we are committed to ensuring that our laws protect everyone while supporting the autonomy and freedom of choice that are central to Canada's MAID regime.
As many of you may know, I am, along with our chief documentary filmmaker here at Rebel News, Kian Simone, working on a documentary on the horrific expansion of Canada's euthanasia policies, what we call medical assistance in dying, or MAID.
Medical assistance in dying is an extremely difficult and personal issue for individuals and families. As a government, we need to make sure that the framework and the resources are in place for people to make informed and proper decisions. We've always striven as a government to be there to support people's rights and their choices, while at the same time making sure we're protecting the most vulnerable. And it's not an easy thing.
You can learn more about what we're doing and how to support our efforts by visiting maiddocumentary.com. Our National Medical Assistance in Dying policy has gone from a program meant to assist the terminally ill who are imminently dying to a program that now currently ends the lives of the chronically ill and the medically inconvenienced.
We know we need to get this right in order to protect those who are vulnerable and also to support an individual's autonomy and freedom of choice. This work will begin in the new year. Right now, we want all Canadians to know, especially those exempted by the current exemption of eligibility from MAID, that we plan to take this next step. This is a top priority for our government, and we want to reassure Canadians that we are committed to ensuring that our laws protect everyone while supporting the autonomy and freedom of choice that are central to Canada's MAID regime.
And come March 2024, that program will further expand to include people whose only health concern is mental illness. And in doing research for our documentary about what's currently happening in Canada's euthanasia system, we stumbled upon this at a pro-euthanasia blog. MAID, that's Medical Assistance in Dying, has been provided in various locations, including a health facility, funeral home, and even outdoors on private land, although Parks Canada also has a MAID policy allowing MAID in some parks in certain circumstances. At first, I was shocked to read this. How could this possibly be true? But then I remembered where I am and what we're about to do in Trudeau's socialist hellscape, where the nation is being blanketed by a culture of death. In Canada, we're a place that's expanding this state-sanctioned homicide program to include people who are eccentric, body dysmorphic, or even just sad. So I reached out, like any good journalist would, to Parks Canada for confirmation. Here's the list of questions I sent them. According to the Canadian Association of MAID Accessors and Providers, Parks Canada also has a MAID policy allowing MAID in some parks in certain circumstances. I'm looking for information on what that policy entails. What does one need to do to access this policy? Does the MAID recipient need to first alert park staff to where inside the park they will end their life? What provisions are being taken to ensure the public or unsuspecting park staff do not stumble upon the deceased? Can one end their life via MAID in any national park, or is the practice limited to certain parks? If so, which parks? Now, here's what I got back after over a week of waiting for a response. Parks Canada recognizes that many Canadians have personal connections to national historic sites, national parks, and national marine conservation areas. These treasured places can provide physical, emotional, and spiritual comfort to those at the end of life. While Parks Canada continues to develop its protocols and guidance with respect to MAID, We evaluate requests on a case-by-case basis when a person eligible for MAID would like to pursue this medical procedure at a Parks Canada administered location. It's a confusing and frustrating non-answer, but the non-answer is an answer in and of itself because it's clear. You can suicide yourself in a national park in Canada. And while Parks Canada says they don't have an official policy, it's clear they have a policy to take these things on a case-by-case basis. Now, they refuse to tell me if they have any protections for regular old parks users like me to prevent us from stumbling across the deceased. Because frankly, I don't think they've even thought about that issue. Parks Canada, as an extension of Environment and Climate Change Canada, which of course is under the umbrella of Trudeau's government of death, has only thought about the death side of this and not, of course, the consequences for the living. So what's the moral here? Beware in our national parks system. It's not just the wilderness and the wildlife we need to worry about now. It's the death too. For Rebel News, I'm Sheila Gunn Reid. To find out more about our Rebel News documentary project about Justin Trudeau's expanded euthanasia protocols and to help us shine light in the darkness of this issue, please go to maiddocumentary.com.